Welcome to Have More Babies. Today we're diving into something that, well, it often sends a shiver down a parent's spine, doesn't it? Febrile episodes in children. That word febrile, it can sound pretty alarming. But our goal today is simple. Unpack it, clear things up, and hopefully give you more confidence. We'll explore what febrile really means, what causes it, the symptoms you might see, and how to manage and even prevent these episodes. And we're basing this all on solid, trustworthy information. Joining me to guide us through this is our expert, ready to jump in and talk fevers.
Absolutely. It's such a key topic for parents. And yeah, there's definitely some anxiety around it that we can hopefully ease today with some good information.
Great. So let's start right there with the word itself, febrile. It just sounds serious. More than just saying feverish. What do we actually talk about?
Yeah, it does sound a bit medical, doesn't it? But really, febrile just means related to or characterized by a fever. It's not a disease on its own. It's just a description. Like saying someone's tired. It describes a state, right? And fever itself, well, it's actually the body's natural response, usually to infection. It's the body raising its temperature to fight something off.
Okay, so it's a sign the body's working, not necessarily the enemy itself.
Exactly. Up to a certain point, like maybe 102 Fahrenheit, a fever can actually help the immune system work better. It makes it harder for viruses and bacteria to multiply, and it kind of kicks immune cells into higher gear. So yeah, think of it as an alert system, a defense mechanism, not the problem itself.
That's a really helpful way to frame it. A helper, not a villain.
Yeah.
So if fever is a response, what's usually triggering it in kids, they seem to get fevers quite a bit.
They really do, and the vast majority of the time, we're talking about infections. That's what most parents think of first, and they're usually right. Viruses are the big one. You know, things like the common cold, the flu, hand, foot, and mouth, the stuff kids pass around all the time.
Okay, so mostly viruses. You hear that viruses just have to run their course.
That's generally true. The fever is part of that process. Then you have bacterial infections. Less common, but sometimes more concerning. Things like strep throat, ear infections can be bacterial, urinary tract infections, or UTIs. These often do need specific treatment, like antibiotics. The fever mechanism might be slightly different too, maybe triggered by bacterial toxins.
That difference, viral versus bacterial, seems crucial then, especially for treatment decisions. But are there other reasons, maybe less common ones, for a fever besides an active infection?
Yes, definitely. It's not always an infection. Immunizations are a perfect example. It's actually quite common and normal for a child to get a mild, short-lived fever after their shots. It's just their immune system learning and building protection. It's a sign it's working.
Ah, right. The post-vaccine fever. Good to remember that's expected sometimes.
Exactly. And then, much less commonly, you might have underlying inflammatory conditions. Things like juvenile arthritis or inflammatory bowel disease. If fevers keep happening without a clear infection, that's something doctors might look into.
Okay. What about teething? That's always the big debate among parents. Oh, he's got a fever, must be teething.
Right, the teething question. Well, the general consensus among medical professionals and what our sources suggest is that teething is pretty controversial as a cause of true fever. It can make babies uncomfortable, maybe a little irritable, gums might be inflamed, maybe a very slight temperature rise. But a real fever, say over 100.4 Fahrenheit or 38 Celsius, probably not just teething. It's
Right.
more likely the baby picked up a mild virus at the same time,
Yeah.
They put everything in their mouths then. So if there's a proper fever, it's wise to look for another cause.
That's super helpful clarification, especially putting teething in perspective.
Yes.
Okay, so we know what febrile means, why it happens. Now, how do we recognize it? Beyond just a warm forehead, what are the signs parents should look for?
Well, the obvious one is checking the temperature. A reading above 100.4 Fahrenheit or 38 Celsius is generally considered a fever. How you take it matters a bit too. Rectal is often most accurate for infants, but temporal, the forehead ones, are pretty good for older kids. But it's not just the number. Look at the child. They might have chills or be shivering, even if the room is warm. That's the body trying to generate heat.
Okay, chills. What else?
Fatigue is a big one, just lower energy than usual. They might be listless, sleepy, not playing much, just seem off, and body aches. They might complain of muscles hurting or just general discomfort all over.
So it's the whole picture, not just the thermometer reading.
Right.
Okay, so we see these signs, we take our child in. How do doctors figure out what's really going on? What's the diagnostic process like?
It starts with listening, actually. A good medical history from the parent is huge. What are the symptoms? How long have they been going on? Any sick contacts? How's the child eating, drinking, peeing? Their overall behavior. Parents know their kids best, so that information is gold.
So the story matters a lot.
Absolutely. Then comes the physical exam. The doctor will look for clues, checking the throat, ears, listening to the lungs, feeling the neck for swollen glands, maybe checking for a rash, looking for signs of dehydration.
And if the history and exam aren't quite enough, what then?
Then we might move to tests. Blood tests can be helpful. A CBC, or complete blood count, can show if white blood cells are elevated, and sometimes which type, which might hint at bacterial versus viral. Other markers, like CRP, can indicate inflammation. There are also rapid tests for things like strep or the flu.
Okay.
And in situations where things seem more serious, maybe the child is very lethargic or has specific worrying signs like a stiff neck, then other tests might be needed. Maybe an x-ray if pneumonia is suspected, or even a lumbar puncture, a spinal tap if meningitis is a concern. But that's definitely not routine for most fevers. It depends entirely on the clinical picture.
Right, it sounds like a step-by-step process tailored to the child. That's reassuring. So let's say a cause is found, or even while figuring it out, how do we manage these episodes? What can parents do at home, and what might doctors prescribe?
Management is really focused on comfort and support. Over-the-counter fever reducers, antipyretics like acetaminophen or ibuprofen, can definitely help bring the temperature down and relieve aches. Super important. Dose based on the child's weight, not their age. Always follow the instructions, and alternating them isn't usually recommended anymore, can lead to mistakes. Stick to one, timed correctly.
Okay, weight-based dosing, stick to one medication. What else?
Hydration. Hydration. Can't stress it enough. Fevers make kids lose fluids faster, so push fluids, water, electrolyte drinks if they're older, breast milk or formula for babies, even popsicles can work. Watch for signs of dehydration, fewer wet diapers, dry mouth, no tears when crying.
Fluids are key. And rest.
Absolutely. Rest lets the body focus on healing, keep them comfortable, quiet activities, don't push them.
Makes sense. Now, what about antibiotics? You mentioned the viral versus bacterial thing earlier.
Yes, critical point. Antibiotics only work for bacterial infections. They do absolutely nothing for viruses, which cause most fevers. Using them unnecessarily is a big problem. It contributes to antibiotic resistance, meaning the drugs might not work when they're really needed later, plus side effects. So unless a bacterial infection like strep throat or a UTI is confirmed, antibiotics aren't the answer for a fever.
That's such an important message for parents. Avoid asking for antibiotics unless the doctor confirms they're needed.
Exactly. And sometimes if a fever is very high or if a child has something kind of febrile seizure, which is a convulsion triggered by fever, usually in younger kids, hospitalization might be needed for observation and treatment. Febrile seizures are scary to watch, but generally don't cause long-term harm. Still, they always need a medical checkup to find the fever's cause.
Okay, good to know. Scary, but usually benign. All right, let's switch gears to prevention. Can we do anything to reduce how often our kids get these febrile episodes in the first place?
Yeah, absolutely. Proactive steps make a difference. First up, vaccinations. Keeping kids up to date on their recommended vaccines protects them from many serious illnesses that cause fever, like measles, mumps, flu, pneumococcal disease. It's huge.
So staying on schedule with shots is protective.
Definitely. And then basic hygiene. Sounds simple, but it works. Teach good hand washing before eating, after using the bathroom, after coughing or sneezing. Use soap and water. Wash long enough. Try to avoid close contact with people who are obviously sick. Cover coughs and sneezes. Keep surfaces clean.
The simple stuff really matters.
It really does. And finally, supporting their overall health helps. A balanced, nutritious diet gives their immune system the fuel it needs to fight off infections better. Plenty of fruits, vegetables, lean protein.
Great practical tips. Vaccinate, wash hands, eat well. So wrapping this all together, what's the main takeaway for you, our listener? We've gone through what febrile means, the causes, symptoms, diagnosis, treatment.
I think the biggest thing is perspective. Remember that fever itself usually isn't the disease. It's a sign, a symptom. Often it's a sign the body is doing its job fighting something off. The real goal is figuring out the why behind the fever and addressing that appropriately while keeping your child comfortable. Knowing this, understanding the process, can hopefully take away some of the fear and replace it with confidence. You know what to look for, when to manage at home, and when it's time to call the doctor.
That makes sense. Knowledge really is power here. And maybe connecting this to the bigger picture. It makes you think, doesn't it? In a world where we can worry about every little symptom, how can we get better at understanding our kids' individual responses to illness? What can we learn by observing their body's own defenses at work? Just some food for thought. Well, thank you so much. This has been incredibly insightful. I feel like we've really demystified febrile episodes.
My pleasure. Happy to help shed some light on it. It's all about empowering parents.
Absolutely. And speaking of resources, if you want even more detailed information, helpful guides, or need to book an appointment for your child's healthcare needs, you should definitely visit omegapediatrics.com. They have fantastic resources and offer comprehensive pediatric care. Again, that's omegapediatrics.com. And hey, if you found this conversation helpful today, please do us a favor. Like this video, subscribe to our channel so you don't miss future deep dives, and please share it with other parents you think might find it useful.
Stay informed, stay well.
Thanks for tuning in to Have More Babies. We'll catch you next time. Bye now.